Like most of us, because of the coronavirus outbreak, I'm stuck at home. As a 15-year-old, I wasn't quite expecting this to be my life as a teenager. Curious about what the world looks like amid the pandemic, I'm talking with people who are on the front lines, helping our society get through this difficult time. Sharing their stories gives me hope, while I'm 15 and quarantined. Hello everyone, welcome to our first video of 15 in Quarantine. I'm your host, Muhammad Ali Rizvi, and today I'm joined by a public health official, Irum Zaidi. Irum, thank you for joining us. Please introduce yourself.
I'm Muhammad Ali. I'm Irum
Hi.
Zaidi. I'm an epidemiologist, meaning I study how diseases spread, is at risk for the disease, where the disease is geographically, which populations it could go to, and help people design interventions that can stop the spread of disease.
So, can you tell us about your work pre-pandemic?
I've spent over 20 years in my career working on HIV/AIDS. I started in the domestic HIV program in the United States, working with community organizations to use data to understand who is at risk in their own community, and then help them understand what HIV prevalence means, incidence, what is a rate, so that they can effectively use data in a way to set their own programs and make sure that resources go where they can have the most impact. I also worked on studies looking at HIV drug resistance and different subtypes. Those data are used to then describe and develop appropriate treatments if there is differences in resistance types, and then also different attack rates that may occur if there are different strains. After working domestically, I moved to working in the global program on the President's Emergency Plan for AIDS Relief. This is an initiative that supports over 50 countries across the world in Africa, the Caribbean, Asia, and Central Asia. I work there with communities and countries to use data again and deciding programs based on evidence and really putting the dollars to where there can be the most impact.
So, how has your job changed because of this pandemic?
So until mid-March, and over the past 20 years, my career and my focus has been HIV. Since mid-March, the end of March actually, I've now been working on the coronavirus, the COVID-19 response. Ambassador Birx, who most people now know as Dr. Birx from the White House Taskforce, came over to work at the White House to combat COVID-19. I'm working now on COVID-19 response. Even though that is 100% of my time, I also stay very closely connected with our global HIV program and ensuring that the programs that we have built continue to serve the populations. Over the past few months, really bringing those analytic skills, the interrogation of the data, and improvement of data quality to this pandemic so that we can appropriately combat COVID-19 in the US and then globally as well.
So I imagine that your experiences with for the past 3 months have changed. So how has your experience different from other American people?
One of the biggest ways my life has been very different than others is that I actually continue to go to work. I know most people have been teleworking, they're staying at home with their families, they're minimizing their exposure and into the outside world. I've also adapted social safe distancing practices, washing my hands, wearing masks. But I do go into the office, which is definitely a very different phenomenon than everybody else. It's been quite amazing to work across different agencies I've never worked with before. They're not really present in our global work. But working across different agencies in the United States, and then working again with the states as I did domestically nearly 15 years ago, and supporting them as really the frontline public health program and making sure they have the resources they need to be able to combat COVID-19.
So, lastly, what is your message of hope for kids and teens like me?
Well, number one, I want to express my deep appreciation for everything your generation has been doing. The adoption of safe practices, the social distancing, washing your hands, wearing a mask when you go out in different conditions has really been a substantial change and unprecedented that we've seen in the world and in the United States. So thank you all for doing that and continuing to stay safe. The other pieces are really around innovation. And your series is one of those examples of innovation that people age are starting to do to bring awareness to what is happening as people are staying in place, are quarantining, and going through the summer and finding new ways to support social distancing and slowing the spread of COVID-19. I am quite reassured that your generation will be able to find new ways to adapt even healthier lifestyles so that we are all healthy, not only coming out of COVID-19, but even as a broader society. I imagine there will be new epidemiologists that are coming out from high schools or budding epidemiologists out of colleges, as well as coming into modeling and different professions that perhaps people didn't know about before and are now exposed to. So thank you, Muhammad Ali, for being a trendsetter in these areas, and I look forward to hearing about your classmates and endeavors that they're making as they go forward.
Thank you. And thank you for joining us, and thank you to our viewers for watching our first episode of 15 in Quarantine, and we'll see you next time. Bye.
Bye.